Hello, everybody. Good morning, good afternoon, good evening, wherever you are in the world. I appreciate you. Thank you for checking out this video. I'm here to talk to you today about prostate stones because that's what I'm dealing with now. If you've followed me and watched my journey from now almost 2.5 years ago, in August of 2022, I had radiation treatment for prostate cancer. I had the aggressive external radiation beam therapy. I had 5 straight days of radiation therapy, Monday, Tuesday, Wednesday, Thursday, Friday. And my radiologist did let me know that there could be some side effects. Well, about 2 weeks later, after my last treatment, the side effects kicked in. I had just about all the worst side effects that one could experience with radiation therapy. Matter of fact, my radiologist said, yep, I was that 2% that experienced all the bad side effects after radiation therapy. If I could recall and run down the list real quick, I dealt with, of course, obviously a lot of pain in my pelvic area. Felt like someone had me by the cojones day in and day out. And then I had a blockage develop kind of like at the top of my prostate where I wasn't able to go to the restroom without having a catheter. So I was cathetering myself. Then I got a blood clot. I was dealing with edema. My legs were always sore. They got tired. I couldn't stand for a long period of time. Couldn't sit for a long period of time. Again, I had constant pain in my pelvic area to where I developed, I believe it was called a hydrocele, where one of my testicles was much larger than the other. So that was very painful. But thank the Lord, that kind of got better. Eventually, I was on blood thinners for the blood clot. That eventually went away. My edema went away. And eventually, I was feeling better. And this happened, I would say, 6 to 8 months after I had the radiation therapy. So even though all the other side effects went away, I was still dealing with cathetering myself, which ultimately led up to me having a TURP surgery so I could void on my own. And that surgery took place in December of 2023, which has now been about 13 months ago. Now, about 6 months ago, I would have to say around the June, July, maybe August time frame, I began to experience pain. There was blood in my urine, and I noticed these little pebbles coming out of me. At first, I thought they were kidney stones. I never had any experience. My lights then went out. So again, around August, or I would say July, August of 2024, I began to experience pain, blood in my urine, and then before you know it, these stones would come out of me. I thought they were kidney stones, and I called my doc to make an appointment, and this was just my primary care doctor. And of course, they always ask, okay, why do you want to be seen? So I was, letting probably a receptionist know why I want to be seen. Because then, they set an appointment for me, which was about a week out. But then once the doctor got the information about why I wanted to be seen, she called me back immediately, told me I need to go to the emergency room. don't wait another 3 or 4 days to, I had my appointment to see her. So I went ahead and went to the emergency room. Me and my wife got there. I explained to them what was going on. Of course, they took my blood, did all the lab work, which the doc said that they would do, and it would be good that she would have that information prior to me seeing her, if for some reason they didn't keep me. And they also did a CAT scan because of, where I was experiencing the pain and the discomfort. And the CAT scan revealed that there was something going on with my prostate. They just said it just did not look right. And they were almost hinting to me that maybe it was cancerous, but they just didn't have enough information to go off of to make that assumption. But one thing they did tell me was that I had a UTI. They had the results of my blood work, my lab work. And they ended up releasing me, gave me some prescription of antibiotics, and told me to follow up with my urologist. And they were going to even send a message to my urologist to let them know that my prostate didn't look right and there was something going on there. And they called. I was there in the emergency room on Saturday. So by Monday morning, I got a call from the urology saying, "Hey, just go home, come up here as soon as you can." And so I did just that. And when my urologist saw me, he apparently knew exactly what was going on with me. And of course, it wasn't kidney stones from the lab work. My kidneys were fine. It was prostate stones. And I've never heard of prostate stones. But what he explained to me was that my prostate was not healing properly. So therefore, it was developing calcification around my prostate, and even, in the urethra part of my prostate. And he had said that it was the worst that he has ever seen. And he recommended that I get that taken care of. And the only way to get it taken care of was for him to go in there and clean it out. But before we made that decision, he wanted me to think about it, pray about it, talk to the wife about it. And then he wanted to even take a closer look, to where he, I set an appointment with him probably about a week later, to where they, got the camera, went inside of me, and, got a closer look at all the calcification that was going on inside of me. Now, mind you, even leading up to that point, to where I actually saw him, probably about every few days, I'm voiding out these prostate stones. And so, and I let him know that. Even took a couple with me to the hospital. And they would be about, maybe the size of a grain of rice. And so, but he said, yeah, that's exactly what that is. But he's never seen anyone that had as much on me than I did. So he said it was completely up to me whether he wanted me to go in there, or whether I wanted him to go in there and clean some of it out, or just leave it alone, because it was not bothering me in terms of my ability to urinate. But he said not taking care of it and your prostate not being healed, and with the calcification, you will always be dealing with UTIs. And so I told him I'd get back to him. So thought about it, prayed about it, talked to the wife about it, and then we decided to let's go ahead and get this taken care of. So I made an appointment for January 30th, which is actually tomorrow. Today's the 29th of January, and we made this appointment back when I saw him. It had to be somewhere around the Thanksgiving holiday, either before or after. And so now I've been waiting all this time to see him. Now, as far as I was concerned, I wasn't voiding out any calcification anymore, because I figured, I didn't let them all out, because they were coming out of me constantly. And then the last time something came out of me, it was huge. So I'm like, I got rid of it all. So maybe I don't need to see the doctor anymore. And even called him up saying, hey, or actually I emailed him to let him know, hey, this big chunk of something came up out of me. Maybe that was all of this calcification, or maybe it was even my prostate, saying that jokingly because it was huge. I never seen anything so big come up out of me like that. But he recommended, we still go forward with it. So if for some reason the calcification was still there, and if it got worse, then I'll be waiting another 2 or 3 months to get another appointment. And so I went ahead and decided, okay, we'll go ahead and I'll let you do what you do. And if for some reason it all came out of me, of course, he'll see that once, he's going in there to clean me out. And so that's where I am today with what's been going on with me, especially since my last video I made 6 months after I had the TURP. And but now I'm going in there, as far as I'm concerned, it's kind of like another TURP, but it's not a TURP because he's just going in there to clear out these stones. And so it's not like my prostate is swollen or, it's clogged up, because again, I've been going to the restroom fine. And especially, having the ability to, have these stones come up out of me. But I do still experience pain. And of course I had the UTI then. I know I have a UTA now, because even they wanted me to get some lab work prior to the procedure tomorrow. And I get my results online, and sure enough, it's all UTI. So I even have a UTI as I speak. And I'm in a little discomfort as we speak. And it's that pain that even the doctor told me after the TURP that I was going to always have this chronic pain. And I have had it every day, all day. However, my pain level is not that bad. They ask you on a scale of 1 to 10, what's your pain level, 10 being the worst. And this pain, if you will, or discomfort that I deal with, it's probably at like a 2 or 3. However, if I sit for a long period of time, or even if I do any strenuous exercising, then that pain can surely go up. And so, but it's manageable. Personally, I don't take any medication for it, although they've given me some ibuprofen to take or some Motrin. And when I was taking it early on, because, that when I was cathetering myself, and when the initial side effects kicked in, like I said, it felt like someone had me by the cojones. Oh yeah, I was definitely taking the ibuprofen, because it's like the pain went away for a good 4 to 5, maybe 6 hours. And so I got that bit of relief, but then eventually the medication would wear off, and there goes the pain again. And but I'm not experiencing that kind of pain or discomfort, and hadn't experienced it probably in about a year, since I hadn't been cathetering myself. But now here we go. I go back in there for them to go in there and clean out, and the doctor told me he's going to try not to hurt me. So I can only imagine that, I'm going to be in a little pain after this procedure tomorrow. And I just pray that he's able to do what he has been professionally trained to do, and can get out the calcification. And then that will be the last time I have to see this urologist for anything. And I'm sure I'm going to have to pay him a follow-up visit like I did when I had the TURP, probably about 2 months after this procedure. So again, probably around the March or April time frame, just to let him know how I'm doing. But in any case, that's where I am now. I appreciate all y'all prayers and your support. And I'm going to go in, start getting myself ready for this procedure. We got to be at the hospital at dark 30 in the morning. Supposed to take place at 7:30 a.m. Probably no more than an hour and a half. And just depending on how I feel and how everything went, they may keep me or they may send me home. We'll see. But I do plan to make a follow-up video, once I'm feeling better, which may be within the week after the procedure, to let you all know how I am doing. And so thank you again for watching, and I'm going to say, to God be the glory. To God be the glory. Because I'm going to tell you, I do feel so much better, pain-wise, discomfort-wise, since the side effects kicked in, almost now about 2.5 years ago. However, I know they say when you have radiation, it can definitely mess with you, for the rest of your life. I know the side of my hips are a little sore, especially on this right side, because that's where they come in with the radiation, on my left hip, my right hip, and then right below my stomach area. But so far, just been my hips. So I can't stand for a long time. And I just can't do some of those things that I was looking forward to get back doing because of the radiation. I know it just took my leg strength away from me, because I even tried roller skating and I just can't skate like I used to. And I think I shared that in the previous video, because the muscle in my legs aren't there like they used to be. And of course my testosterone levels are low. I know generally when you get radiation, they will ask you if you want the hormone therapy. And I turned it down because that in itself comes with side effects. And the doctor even told me, yeah, if we were to boost your testosterone levels, then that could, bring back the cancer. So that's all I needed to hear to say, well, no, I'll pass on the hormonal therapy, and so with that, the last time I had my testosterone checked, it was still pretty low. So that's, causes I just don't have any energy day in and day out to do the things that I used to do. I got to kind of pace myself so I don't wear myself out, And of course, my doctor tell me too, well, you're getting older too. And that is true. But still, I like to stay active if I can. But it's hard when you just don't have the energy to do that. So in any case, I thank the Lord. I'm still here. I'm alive. I'm well. Looking forward to my life after this treatment, and pray that, I can continue to live my life to the fullest, as Jesus said I can. And but just continue to be well, to be healed, and just continue to live my life in a productive manner, while I'm still on this side of heaven. So again, to God be the glory for the things he has done in my life. I thank him, my Heavenly Father, for all that he's done and just been with me through it all. And I know he's going to be with me tomorrow through this procedure. For he said he'll never leave me nor forsake me. And I believe that. I trust in him. I trust his word. And I pray that you do the same. So just remember, Jesus loves you, and so do I. So you all have a good day, a good evening, or a good afternoon. And please feel free to share, like, comment. I appreciate your comments, your questions. I'll respond as quickly as possible. And thank you. Thank you all again for your love, your prayers, and support. They mean so much. Take care, and I'll be talking to you again soon.